Hi guys, I have another lecture here on electrolytes. Again, this is Caesar with Nursing School Made Easy. Today's topic is magnesium. And we're going to start off with hyper-magnesemia. Now, first of all, how is magnesium regulated? Well, it is regulated either through GI absorption and or renal excretion. So this is again regulated by your intake and by your kidneys, again through excretion. Make sure you understand this concept. Now, what are some causes of hypermagnesemia? Number one, renal failure. Number two, excessive magnesium intake. Now, this could be either somebody who is consuming magnesium and has some type of renal failure or chronic kidney disease, or maybe this may be a patient, a pregnant patient who is suffering from eclampsia. With pregnant female suffering from eclampsia, one of the treatments may be magnesium administration. Therefore, you would increase the amount of magnesium intake. Okay, so again, you have two different patients in that scenario. Now, the excessive magnesium intake would be, for example, something like Malox or milk of magnesium. So with these patients, you would tell them to not drink or consume any magnesium containing products. And again, this is with the patient of some type of chronic kidney disease, some type of renal failure, whether it's acute or chronic. Number three, adrenal insufficiency. Now, what are some signs and symptoms of hypermagnesemia? Now, before we get into that, a little side note, again, put your little star beside that note. Understand that magnesium, again, magnesium is going to have an effect on neuromuscular excitability. Again, neuromuscular excitability is affected by whether you're either suffering from hypermagnesemia or hypomagnesemia. In this case, we are focusing on hyper. And what it'll do in hypermagnesemia is it will cause depressed neuromuscular and central nervous system function. Again, that is depressed neuromuscular and central nervous system function. So make sure you know that. Now let's focus on our signs and symptoms. Number one, drowsiness. 3, that's 3 on my list, but we're going to put that as 2 because we're kind of focusing on the central nervous system for now. So number 2, decreased deep tendon reflexes. 3, somnolence. 4, respiratory and cardiac failure. Now again, we just talked about how hypermagnesemia is going to cause depressed neuromuscular and central nervous system function. That will explain the symptoms, signs and symptoms 1 through 4, again, of drowsiness, decreased deep tendon reflexes, somnolence, and respiratory and cardiac arrest or cardiac failure. Now, the other thing would be nausea, vomiting. So what would be some interventions? Again, make sure you know all of your signs and symptoms, because again, on the NCLEX exam, it could be select all that apply. So make sure you know your signs and symptoms, and now your interventions. What would you do for this patient that is having some hypermagnesemia occurring? Number 1, again, we talked about this briefly. People with any type of renal failure, any type of chronic kidney disease, you should inform them to not consume any magnesium containing products. It could again be Malox or something like milk of magnesia. You need to tell them to not take it, okay? Do not consume these products. You also want to make sure that you inform that they know to check any types of medications, anything that they're ingesting, and make sure that they do not contain magnesium in them, because again, if they have impaired renal function, they cannot excrete the magnesium. Number 2, if the hypermagnesemia is extremely high, you will give something like calcium chloride IV or calcium gluconate. So know these 2. The other thing that you will do is dialysis. Now again, remember that excuse me, these patients most likely have some type of kidney disease, whether it's again renal failure, acute or chronic. In that case, the patient will most likely need dialysis, because again, their kidneys cannot excrete the potassium on their own.